I'm from Iran. So med school was the second largest med school back in Iran, in east of Iran. And I did residency, my first residency over there, and I came to US at 2016. So neuroscience was like always like starting from, first years in med school. Neuroscience was the material which I was interested a lot because there's some part of mathematics in neuroscience, and also it makes sense to find the area of pathology going back, starting from symptoms, sign, like more rely on the physical exam, more challenging diagnosis. And there's a lack of knowledge in terms of human brain, in terms of neurophysiology. So those were the things I interested in to, put my first steps in neuroscience. And even switching to internal medicine here in US at the beginning of my journey here in US, Fortunately, I could find a way to switch back to neuroscience and starting neurocritical care. So from even teenager years, patients which got into like acute onset MS, to elderly ages with different types of strokes. So obviously that's very stressful for our patients and the families. Even hearing about ICU or critical care, but our team here, always we try to, take care of the critical part of our patients. In the same time, I started to have a good rapport with the families, with the patient, go through the process and, explain everything in terms of what should be the expectations in a day or in near future or even in longer term. So kind of every day having a brief moment with at least a brief moment with the family members and the patient together at bedside, and go through all the findings in the last 24 hours and guide them and mention about general expectations in terms of outcome. I think that will help them to kind of know what's the process look like and how will be the outcome, at least the expected outcome in near future. Yeah, me and my wife, we are hikers. We like hiking, and I know we have lots of opportunities around here. The thing I started to learn and practice more is computers, like, computer science, basically more hardware, computer assembly. But I still at least, assemble 1 or 2 computers per year.